again to another Explore Owens. Once again, my name is Maddie Harris, part of our admissions team here at Owens Community College. Thanks for connecting with us today. We are once again joined by the great Irene Jones. She is the chair of our nursing department here at Owens. Irene, it's always a pleasure to be here, talk about your programs.
Thank you.
Today we're covering the RN, the Registered Nurse.
The Registered Nurse Program, absolutely.
Go ahead, dive right on in for us.
Our Registered Nurse Program is 4 semesters. So we start in the fall semester and in the spring semester on both the Toledo and the Findlay campus. So we have plenty of opportunities. It is selective admissions. So just because you're admitted into Owens does not guarantee you admission into the program. However, we have fantastic advisors that will work with you on an individual basis in order to help get you ready for the program and make sure that you have enough points to be admitted.
How many students do you all take every year? We've talked a little bit about selective admissions here before on these sessions, but can you give us just a brief overview?
Right now, we've had to make some slight adjustments due to COVID, but right now we will admit about 260 students per year amongst both campuses. So, and we start full classes routinely.
Awesome.
So it's about 100 here in Toledo and 25 in Findlay each semester.
Gotcha. Wow.
Yep.
And that January 15th is still that review date for your complete file for that competitive selective admissions process.
Absolutely.
All right.
Yep.
You said 4 semesters?
4 semesters. It is built to be completed in 4 semesters. However, many of our students do come into the program having already completed many general education classes. So because they've already done general education classes, they may have been a student prior to coming into the program. But once you're in the program and our prefix courses, and you are, those are 4 semesters. So students can choose to take it in 4 semesters, or they can choose to take some of those general education classes, English, anatomy and physiology, prior to coming into the program. Sometimes when students do that, it'll help lighten the load a little bit with the intensity of the nursing classes.
Oh yeah, this is a very rigorous program.
It is.
Can you tell us a little bit about clinical rotations during that time?
Clinical rotations.
It looks a little different now.
It looks a little different right now, absolutely. But prior to COVID, our students, actually, we're still very lucky right now. Our community partners are welcoming the students into the clinical facility. So we're wrapping that up for this semester. But starting week 3 of your first semester of nursing school, you are out there with nurses on the floor at the clinical facilities. We use multiple agencies in Northwest Ohio, from Toledo down into the Findlay area, down to Lima, Fremont, that type of thing. So we have plenty of clinical experience. We do have some adjustments being made for OB and PEDS because of COVID, but routinely our students are taking care of patients across the lifespan throughout the 4 semesters. And then at the completion, in your 4th semester, you actually will work one-on-one with an RN at a facility to gain what it looks like to be one-on-one, have 4 or 5 patients, really function as a nurse right before you're getting out there to take your NCLEX.
Just such great experience to gain.
Absolutely.
Is there anything as far as careers go? RN seems a very straight and narrow path. You're going to be a registered nurse at the end of the program. Is there any flexibility for careers after the completion of the program?
Absolutely. When you complete our program, you graduate with an associate's degree. Many of our students then do continue on for a bachelor's degree. So what a lot of them will do is they will start working at our community agencies, many of which have tuition reimbursement.
Nice.
So we do encourage our students to continue on for that bachelor's degree because you can't stop learning as a nurse. You are constantly learning, constantly improving your skills, and going on for that bachelor's, if not that master's, the nurse practitioner, is always a benefit. But starting here at Owens will start you on that path.
Awesome. Well, Irene, thanks so much for your time today. All great and wonderful information about a very popular program that we've had here for several years at Owens. Thanks for joining us again online and connecting with us. I wish you well on your journey, and remember that your success can start right here at Owens with Irene.